Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. As we head into 2015, we're looking at some of the stories our doctors found to be the most important this year and that will affect us in the coming year. First up, Alzheimer's. 5 million Americans are diagnosed with the disease, and cases are on the rise. So, John, what do we know about what actually causes Alzheimer's?
The person who answers that question, Anthony, wins the Nobel Prize. Yeah. So here it is. Yeah. A lot is known, but we don't know for sure what causes it. We know that what is there in people who have Alzheimer's. So there is abnormal protein called amyloid, beta amyloid, you've heard of that, or tau tangles, this is another abnormal protein. We know that there are changes on the MRI scans, on CAT scans. We know that there are changes in the physical exam and in the neurocognitive exams. What exactly is the first event or series of events is not clear. It looks now that inflammation probably plays an important role, but exactly how it works, unclear.
But what is the difference between dementia and Alzheimer's?
I love that question because there's such confusion about this. So up above, broad category is dementia. Yep. Now, under the broad category of dementia, there are lots of things that can cause it. The most common by far is Alzheimer's. But about a third of people who have dementia have a contribution by vascular dementia. That means that there are tiny little mini strokes or not enough blood supply to the brain. There are other things that cause dementia, problem thinking. That's low thyroid, all sorts of other vitamin deficiencies can do it. Parkinson's, you can have dementia with that, and there are other neurological conditions that are associated with dementia. So dementia is the big category, and then there are other things that are under that.
We are, Holly, seeing some promising research here, aren't we?
Yeah, you know, in my opinion, the most breakthrough research this year really had to do with early detection. Two studies, one from the National Institute of Aging, they actually discovered a protein in the blood called IRS1, which can be screened for 10 years before symptoms of Alzheimer's start, and it has, in theory, 100% accuracy. This hasn't been done on a large scale yet, but it seems very promising. The other involves a retina scan, also looking for a protein, a beta amyloid protein in the eye, which also opens up the idea of being able to pick up Alzheimer's before symptoms start. And that's so important because we know all intervention, whether it's diet, lifestyle, medications, they all work best early.
This year, we've seen an explosion of health apps and devices that measure our vital signs. And I wanted to ask both of you, I mean, how much do you think these apps potentially could change the way we function and live?
Yeah, I think they can have a tremendous impact and will. These virtual doctors apps are exploding. They are so popular. These are the apps where you can either type in symptoms to get doctors on the other end. You can get their advice about what to do. Some of the apps you actually pay for on a monthly basis or a per appointment basis, and then you have a video conference with doctors. Now, these have been fairly criticized in that that's not the right way to practice medicine. Yeah. On the other hand, they're here to stay, and they do have some benefit in giving people access to care. So I think that's one of the things that's on the horizon that we're going to see continue to explode.
I do love all the new technology that allows us as physicians to figure out what's going on in your body when our patients are at home. Right. So the ability to measure their pulse, their blood pressure, even their cardiogram. I'm having palpitations, a patient might say. So you say, you know what? Why don't you beam me over what your cardiogram is showing? And you can actually do that now. So I think we're going to see more and more of that. We know that your blood pressure can go up in the doctor's office, white coat hypertension. At home, when you're relaxed and it's just your screaming kids who are running around aggravating you, then maybe you get a more accurate blood pressure.
Well, finally, we can't leave without talking about the biggest medical story of the year. Ebola was the outbreak heard around the world. The infectious disease defined 2014 as the most widely covered medical story, even landing Ebola fighters on the cover of Time magazine as Persons of the Year. I also want to ask you both, what do you think that we learned from this outbreak?
Well, this was a terrifying disease. It seems like that's all I was talking about for several months. And you can understand why it was terrifying. 70% mortality reported in West Africa, no obvious way of treating it. Then suddenly it appears in the United States. Initially, there had been some reassurance. We've got this under control. We know how to handle it. And then there were some missteps at the beginning. There was a misdiagnosis in Dallas. And suddenly people kind of lost faith, and they thought, well, maybe we don't have this under control. We learned some lessons there. which is that, number one, some of our protocols needed to be readjusted, and exactly how much of your body should be covered by all the protective equipment. And then also the fact is that we needed to be able to rehearse. It wasn't just enough to have protocols. And you saw these hospitals throughout the country. I'm at NYU Langone Medical Center. They were having drills where they had fake patients coming in, people who were secret shoppers who came in with symptoms they didn't know they were coming in to see if they could pick them up. I mean, really going through the measures to see, are you truly able to handle this?
You know, one of the things that I find interesting is that the strong media coverage has been criticized, in part fairly, because it theoretically made people panic or caused unnecessary worry. On the other hand, it does have a silver lining. It really raised awareness. We appointed an Ebola czar in our government. And on an international level, it shored up resources to West Africa, places that need it the most. So I think it's prepared us for other outbreaks going forward, and it's helping Ebola right now.
I do want to say something about the CDC, the Centers for Disease Control, because they really took it on the chin with a lot of criticism about this at the beginning. But think about this. They were responsible for all the follow-up, tracing contacts who had been exposed. And you think about what happened just in Dallas. They meticulously found out who was out there who had been exposed, and they were able to follow them out for the 21 days. And they helped arrange for that to be done throughout the country in concert with local authorities, local health and state officials. Well, because of that, we were able to say the 21 days is up, nobody's gotten it, and sort of go like that. Whereas in West Africa, they had no idea who was out there.
Right.
Yeah. There was no moment when you could say, okay, we're kind of out of the woods. So I think that was a huge effort, and they really didn't get any credit for that. The other thing that I would just leave with is, this is a lesson to say we cannot leave it to the last moment. Cut research for years and years and years and then say, where's the vaccine? Where's the treatment? Right now, there's no doubt in the future there'll be another one of these. It's a very small world. It'll be Lassa fever. It'll be SARS. It'll be H1.
We are a global health community.
Right.
It all matters.
And it's all going to, somehow it's going to happen again. There'll be another outbreak. And at that point, we shouldn't be saying, where's the vaccine? Yep. Where's the treatment? Let's start working on it now. We have to fund that research.
Well, Dr. Jon LaPook, Dr. Holly Phillips, we want to thank you and credit you both for a wonderful year of medical advice. Thank you both.
With you guys.